Now, today in the world we are living, let me say 2025, we've got a vaccine which can prevent the cervical cancer from happening. So when you ask me what is cervical cancer is, it's caused by a virus. 90% of the cervical cancer is called with a virus called HPV virus. It is human papillomavirus, which has got about 200 different varieties. The most dangerous cancerous one would be number 6, 11, 16 and 18. I won't go into detail of it, more scientific. So there is a vaccine now that the girls can take as early as between the ages of 9 years till the age of 45 women. The doses of this vaccine differs, however. If we have time, I can do a little detail that the girls, like the Federation of Obstetric Society of India, have come with a vaccination schedule. Girls between the ages of 9 to 14 years will get 2 doses of these vaccines. So suppose I give the dose today, 0. After 6 months, the second dose will be taken. But if the girl comes to me at the age of 15 or beyond, so the doses will be 0, 2 and 6. That means 3 doses. Now, there are many varieties of vaccines, Sangeeta, which have come. We are very lucky now. We are living, especially the young generation now. There is a quadrivalent vaccine, which is covering just 4 of these HPV variety serotypes. There is a one which is more now recently come, which covers 9 serotypes. So that means a nanovalent is much effective, more coverage of the HPV virus. In India, we have 17.7% of the women getting involved in cervical cancer.
One type of cancer you can prevent.
Absolutely.
But this cancer happens because of this human papillomavirus.
Papillomavirus.
Yeah.
Yes.
So from where does this virus, how does this infection happen or spread?
Good question, Sangeeta. So the way it spread is through skin contact. So you have to avoid from having multiple partners for sexual contact. So skin to skin, and it invades through the skin, invades through the mucous membrane of the cervix, the vagina, which is a place that it could just invade and go. To oral sex, anal sex. So all these things tries to give. So let me also say, not to make everybody frightened, but 90% of us carry this virus, HPV. However, however, it doesn't show in all people, in all of us.
You mean it's dormant in us? The virus is there, but it is dormant.
So not all HPV viruses, as I said, 200 of them, not all are cancerous.
Okay.
Just few of them. Even wearing condom during sexual contact cannot prevent this cancer, because the condom doesn't, cover the skin area. So this is something which is very important. All should know, because this virus causes, even in men, penile cancer, anal cancer, throat cancer. So they also will harbor this infection. And if it invades, and so that's the reason why the earlier we give the vaccine to girls who have not had sexual contact, who do not go during ages of 9 to 15 years, any, dirt of a kind of a penetration in the cervix, any infection, they don't have during that period. So the chances of HPV getting into them is very less. Compared to a woman who's given childbirth, there is injury in the mouth of the cervix during a normal child delivery. That injury, if it harbors the infection, HPV virus, the virus can gradually climb up. Another thing I must say here, even if that patient gets one of those cancerous variety of the serotype, if they get that, for 5 years, 3 to 5 years, that remains dormant inside the cervix.
Okay.
But if you have multiple acts of sexual contact with a person, your immunity is down, you're smoking, alcohol, there are so many things related, then that will keep on invading. So you have a little white discharge, you have a little ulcer, you don't take care of it, you don't go to your gynecologist, you're not doing your pap smear on time, you're not doing the proper treatment, you're not treating the infection. that will again go within 10 years' time, grow up to be a 100% cervical cancer, invasive cancer. When we know there is a cervical cancer vaccine, when we know that we have to avoid